folks, and thanks for joining us today. This is Paul Swider from the Boston Healthcare Cloud Technology User Group, and it's a pleasure to join you. I'd like to just do a quick introduction before we start the meeting, and also just go over a couple of quick introduction slides. First of all, I just want to give a quick shout out and thank you to Real Activity for sponsoring the community, as well as Microsoft for sponsoring us with meeting space. About us, so our goal is essentially we're a group based out of Boston, but we like to say that we have a global reach. So our mission is to essentially get some of the best speakers in the industry, the real thought leaders, give them an opportunity to do a 30-minute presentation with the goal of inspiring new people to get into healthcare technology and inspire those that are already into healthcare technology, if you will. A really important slide here. I'm going to leave this up for a moment. What you can do is use your mobile device and zap this QR code. And what it will do is bring you out to our link tree. You'll find a ton of information about our community, links to our Discord server. And also worth noting, I'll make sure that these links are in the comments on our YouTube channel. We have links to savings at some upcoming conferences in Boston. So there's the Rework event, which is AI in healthcare. We're going to be hosting our user group there in October, and we'll post a link in the comments. And then there's another CDX conference as well that our user group has been invited to. We'll share the links in our comments. And so with that, I'd like to introduce our speaker this week. It's another great topic. I'm really excited to have Ronak here. And with that, I'll pause for a minute. We'll do a little bit of a screen switch over. And we're looking forward to his presentation, Transforming Healthcare with Intelligent Automation. Just real quick, I had a chance to work with Ronak during the Cloud Wars conference in San Francisco a few months ago. We actually did a similar presentation to this together. It's just a pleasure to work with this thought leader, and it's an honor to have him here with our group. And so, Ronak, I'll turn it over to you now. Thank you.
Thanks, Paul, for having me here. It's my pleasure to be with the Boston community, and the work you guys are doing. It's amazing, and it always excites me. And I think we had really good conversation back in June when we met during the Cloud Wars Expo. So quickly, I'll just share my screen, and then we'll begin with the session. Just give me a sec. And let me know when you guys are able to see my screen.
Yeah.
Perfect.
Good to go, my friend. Thank you.
Perfect. Thanks a lot. So I think Paul already, I'm an automation architect at Mater Hospital in Australia. It's one of the biggest healthcare group based in Queensland. And also being part of the community, I'm also leading a Queensland AI Labs chapter here in Queensland, trying to of AI and automation in Queensland and trying to bridge that skill gap, which all of us are facing these days. So, yep, that's a little intro about me. So today we're going to discuss about and AI in the process automation is helping this massive industry, and also we're gonna discuss a little bit about use cases. We won't be able to discuss many of them, but yeah, we'll try to cover at least 3 of them today. So that's the agenda for today. Why automation is required in this industry, little bit intro about RPA, how it works, and then overview of use cases, and then we're gonna have 3 different use cases majorly used ones in this industry: patient onboarding, claims administration, and vaccine management. So let's begin. First of all, my question to everyone is, why do we need automation in healthcare? And this is one of the biggest industry in terms of patient care, and it's very much different from all other industries like financial services, insurance, uh, supply chain. Every industry has its own aspect, but I think this industry is something where we actually care for patients. So even if you want to do something with technology, we have to be mindful that you are actually impacting the patients at the end of the day. So it needs to be accurate. So these are 2 of the quotes like written by me and in few of my articles before at Acceleration Economy as well. So it says like high cost, high volumes and some regulations which have put a strain on the healthcare system, and the quality and the timeliness of patient care is compromised as a result of these stress. You can see, like, we have seen this during the pandemic as well. This industry was overburdened with work. They had already so much in their plate, but with the pandemic they have got more. And that was a time where technology supported this industry. uh, Whoever was ready with the technology and whoever was already in place of AI and automation. And we're going to discuss this later in our presentation. What are the processes that were automated and how it has helped this industry. Also, like, if you see healthcare, it this industry completely runs in real time with no room for error, as I previously mentioned, because uh, even if you send a wrong appointment to a person who is already suffering from a disease, having his health complications, and if you try to send him wrong details and you're trying to play around with that, it makes them suffer more, and we don't want to do that because they're already panicked. So we have to be very mindful for that. So with all these things, and human errors, many human errors happen at this stage. Compliance issues, regulations, uh, patient satisfaction level is not that great whenever things are being handled manually. So without these reasons, uh, it's very much required that we have some automation and AI in place that can simplify their issues and problems they are facing in current days. And that's where the robotic process automation, a technology we have been talking about from past 2 3 years, and it's in the market as a buzzword and as a new tool for everyone out there. So I think this is one of the technology that is helping healthcare a lot. And I know not many of the healthcare providers have been using technologies like automation and AI, but slowly it is being increasing. I have seen in past 2 years things have changed, and organizations started using these technologies and trying to adapt that. So, what exactly RPA is? So, RPA and AI produce intelligent automation, which employs software robots to perform tasks that humans would normally perform. It exactly mimics how a human perform tasks on a daily basis. As you can see in this image here, how bot is pressing the keys exactly. This is what a human does. So, but these all things are being done on virtual machines, and which you won't realize how it's working, and it works 24/7, which again is a great benefit. Bot can run overnight as well. So that is one of the biggest benefit of this technology. It holds a great potential to quickly increase efficiency, reduce errors, and decrease cost by automating tasks that are manual, high volume, and repetitive. And due to these benefits, the global RPA market is expected to reach $8.75 billion by 2024. This was estimates by Grandview Research. And in few of the Gartner articles as well, you'll find the same. So this is a massive industry, and I think healthcare has a huge potential for robotics process automation and AI. How RPA has helped healthcare? We need to understand, like, the processes in the healthcare industry. I'm a person like who is more process oriented rather than technology oriented. Definitely, technology plays a critical role. It is helping you out, but at the end of the day, you are simplifying a process. So you should understand the process better. Once you get hold of it, that's when technology can be applied correctly. If your process is not streamlined, even though you apply technology on top of it, it might create a mess. And I don't want to create a mess for this industry specifically, because you are dealing with the patients. You have to be very much careful. So first you have to streamline processes that can give you greater efficiency. You should also make sure your accuracy rate should be high. You need to improve the regulatory compliance, because that is one of the factor in healthcare industry where you have many compliance issues, and it is huge. You need so many human labors to work on those compliance issues, because it has thousands and thousands of rules, and that is not possible from a human to remember everything and keep track of it on a daily basis. That's where the machines and technologies like automation help at a greater extent. And I have seen this with my experience. These all processes are streamlined uh, really good when technologies like automations are deployed at a larger scale. So we're gonna discuss it in later part as well. How and when can we do that? So there are various use cases and benefits in the healthcare industry for automation. Uh, but to start with and to get the major use cases, mostly healthcare providers are focusing more on the patient onboarding and appointment scheduling, because patient onboarding is always a pain because you have a lot of paperwork involved in it. Your front desk admin staff, your back office, everyone gets involved to onboard one single patient, right? So this process is completely a rule based process. If you look at this process closely, you will find that this process is built up of 85% rules, and the remaining 15% is maybe going from can go for manual handling. Other than that, you can just put your 15% efforts on handling it manually, and then 85% can be easily automated. And it has proven by now, because we are at a maturity stage in RPA where these use cases have proven to be very much effective for all the healthcare providers whoever have adopted it. So, and one of the biggest thing is you schedule a patient appointment, you send an SMS that your appointment has been confirmed, patient replies back, and those responses are also handled by the bots. If you look at the traditional process, you send the appointment today, even if the patient has replied today itself within maybe few minutes, they get a confirmation maybe a day after or 2 days later. And that's not a good patient experience, right? With bots, all these things can be managed within seconds or minutes. So at the end of the day, you are increasing patient experience, and that is the highest priority thing for me. uh, because this industry doesn't focus on numbers. Like, we don't want to see $1 million saving in this industry, but our focus is more towards patient care. How have we increased, and how much patient experience have we increased? So, because in financial industry you always talk about numbers, but this industry doesn't care much about numbers. You definitely will have few savings, but more than that, the focus is towards providing the better care to the patients. And that's where another one is claims administration. This is one of the hectic process in the healthcare system. If just take an example, whenever you get admitted to a hospital, and when you're done with it and you're going to discharge, that process takes lot of time, because they do their validations with your private health insurance provider, your Medicare card provider, and then they get revert back that these many things were not covered, and these will be your out of pocket expenses. And then they do to and fro communications with you, and after a few hours of time, when all these things are sorted out, you get discharged. So what if you have bots in place? As soon as you are onboarded into the hospital, we do the pre-checks. The bot does the pre-checks and tell the patient beforehand that these will be your out of pocket expenses, because these things are not covered by your Medicare or your private health insurance. This way you are actually creating a transparency with the patient, so that at the end you don't mess up, right? So again, everything comes back to the one point: patient experience. And that's what very much important is. And another one is vaccination management. This is a regular sort of thing in healthcare space, because you do have vaccinations quarterly: your flu vaccinations, your newborn vaccinations, and now COVID-19 vaccinations. So this is a day-to-day thing for healthcare space, and it has again a huge potential to automate this complete process. And I'm gonna discuss this in my later part. And then compliance regulations, and also newborn registrations, because you get new babies data every day, and until you uh, create their entire profile, parents of that baby cannot proceed with any of the documentation until the hospital gives the sign off. So what if we automate this thing, and patient and the parents of the newborn babies receive their entire documentation on the same day or maybe a day after? That again creates a good experience. So these are few of the use cases, which are being used widely in this industry. So let's start with our first use case, which is patient onboarding and appointment scheduling. So RPA could greatly increase efficiency by scanning incoming data and settling up appointments based on the relevant data such as symptoms or suspected diagnosis, doctor availability, location, or most convenient time. So all these factors can be considered for the automation, because these are all rule based. They need to check doctor's availability into different portals and get back to the patient and keep that conversation ongoing. And through automation of patient scheduling and appointment reminders sent by the RPA bot, patients are less likely to forget their appointments. So this is one of the key point here. When the bots are processing things, they are also sending the reminders to the patient, and they're updating the details in the patient care management system at the same time, which means the patients won't be forgetting their appointments because they're getting reminders just a day before, uh, and they're making sure all of their details are up to date. And this will optimize the patient admission and discharge, as I discussed before. So this is one of the key point of this process. Another one is RPA bot streamlined front office support. Yep, we know that once the patient on.
Excuse me.
Sorry.
Apologize. I think we are seeing only the first slide agenda, and many of the attendees are wondering if you're showing slides.
Yeah, I am showing the slides.
I think if you have two screens, we're seeing the wrong one probably.
Let me reshare maybe. Are you able to see it now?
We see your PowerPoint.
Okay, just let me
Thank you so
reshare
much, and
again.
thanks to all the audience for
Yeah,
being attentive and sending us your comments.
just a second. Let me reshare. Sorry for that. And thanks, Diana, for letting me know.
Sure. But
Yeah, no problem. It's a, by the way, fantastic presentation. There's a lot of really great comments coming in online, and thanks for checking in on the slides, Diana. And yeah, okay, now I can see the.
Can you
Yeah,
see
now
it is
it's
navigating?
yeah. Before
Yeah.
it was stuck on the agenda slide before. Yeah. Okay, so I'll be quiet now. I'll let you go. But yeah, great presentation.
Thank you.
Thanks.
Yeah, so sorry. I think I've covered all these. But are you able to see the navigation of slides now?
Yep. Now they're flipping through just fine. Yeah.
Perfect.
Okay.
Yep. So I was on patient onboarding and appointment scheduling. So basically, RP bots streamline the front office as the back office operations. And RPA solution in the front and the back office allows healthcare providers to offer a higher quality of customer service. So you must hospitals. It's just because your admin is preparing your documents, preparing your base documents, in doing these all things. Anyone in my healthcare group where we are working, we have automated this entire process. And earlier, traditionally, we were scheduling 200 appointments a day, but now then again the same amount of reminders and patient responses is running continuously in the background. So that is one of the real use case scenario, which can be done and adapted by your organization as well. Another one is claims administration. So if you see this third point of according to the users, $60 billion annually because humans make mistakes while Medicare. Once the patient goes on, that's when the private Medicare provider or your government Medicare card happens. And but because there was mismatch of the medical codes in it, sometimes hospitals need to pay from their pocket. So this is 100% sure that machines won't make mistakes. Even if they find something unusual, they're gonna raise an exception for the human to process it. So this can be completely eliminated. All the follow-up requests for prior authorization for claims, communicating automatically with the patient, vendor, and all involved constituents. Bots can handle that. So this is again one of the scenarios where we have done the health fund checks before the patient is even coming to the hospital. We know what sort of Medicare he holds. Does it cover all the things, what surgeries he'll gonna get over here? So we do communicate these things beforehand, so that at the end of the day, patients doesn't need to argue why this is coming out of pocket. It's covered in my claim. So this is sort of transparency you create with between the hospital and the patient. So this is again one of the biggest one: claims administration and management. Vaccination management. This vaccination management rollout was huge during the pandemic for COVID-19 vaccinations. Now just imagine a situation when you got your COVID-19 vaccination. Now you're waiting for 4 to 5 days to get your vaccination certificate, and without that you cannot travel, right? We all of us have went through that pain where you have got the vaccination, but you haven't received the certificate. You're waiting for it so that you can upload it and travel wherever you want. Just imagine when you have a bot in place. After you get your vaccination, before you reach home, you have your certificate on your email. And this is something what we did over here. As soon as the patient gets the vaccination, we have already have the entire digital record and patient information in our system. We extract it, we upload it to the Australian immunization record. Once it is uploaded, your certificate is ready. Now look at the traditional way where you get the vaccination, whether it's a COVID-19 vaccination or a flu vaccination, any sort of vaccination. It gets uploaded, maybe 3 days later you receive the vaccination, because human is doing that, and there's a huge backlog of items to be processed. So you need to wait 3 to 4 days, of maybe a week, sometimes a week, for your vaccination certificate to arrive on your email. So now that thing can be completely removed, and believe me, this entire process can be 100% automated. Once you have that digital pipeline of data coming in, you know the batch number of vaccine, what vaccine it is, you already have all those details in. The entire thing gets uploaded to the portal by the bots. And we have done this before, and during the COVID-19, during the pandemic, it helped us a lot. It has saved a lot of time for the admin staff. So they just need to focus here, whatever you see here in the image. They just need to focus on giving the vaccination, not uploading the details. All the administrative work have been removed uh, after automating this vaccination program. So this was one of the biggest wins for us during pandemic. And also we do get quarterly flu shots over here in Australia. So we get huge queues and huge backlog for flu vaccination. So that is completely eliminated after having automation in place. So bot continuously runs every 10 minutes just to make sure any new vaccination happened. It just uploads it. So on an average, how we counted is, okay, if a person is vaccinated now, before he reaches to his home, he'll have the vaccination certificate in hand. So which is amazing patient experience. And believe me, when I got this, I know my bot is running when I got my vaccination, and before I came from hospital, my certificate was on my email, my gov portal. So which was a great experience. And that time you realize, okay, technology is helping all these things out. So at the end of the day, patient experience matters. So these are few of the examples which I've shared have contributed in enhancing the patient experience. And why I'm stressing on having patient experience again and again, because this industry doesn't believe on numbers. We don't care how much are you saving. Definitely you're gonna save a lot with automation, but here the focus is more towards having that good experience. We don't want our patients to get stressed with our technology mess, right? We want them to have accurate details, simplify their lives, because when you say automation, automation means simplifying lives, not to create a mess. And how to handle that? You have to code properly. You have to write code in a way that you handle right exceptions. Even if something looks unusual, those all things can be, can be sent to the staff for manual processing. But you should not send the incorrect details to the patients. That's what I focus more on as an architect, that we do create the robust code, we do have the proper code reviews, and make sure our technology doesn't impact our patients. If we send the wrong appointment details, patient will be stressed out. We don't want to do that. So make sure we focus on that. And all these use cases, whatever I have discussed over here, that helps a lot in enhancing the patient experience if implemented in the right way. So I think that's it.
Yeah, that's really amazing, Ronik. There's so much in there to unpack. I'm sure folks are going to enjoy the video at many different levels. From like, I really like the conversation around triage and how you pointed out that the bot's always on, right? It's always able to triage and do its task 24 hours a day, and the savings that are associated with that. I also really liked how you talked about the patient experience, and I think patient access is part of this, right? Like making sure that I guess it would be fair to say, I think that for a good patient experience, it all starts with access. Like folks have to have access to that healthcare, right? And so a lot of the technology that you're talking about here, the bots and the automation facilitates this this access. I'll just share a quick stat with you in closing. I just learned a couple weeks ago, 55% of unneeded hospitalizations in rural areas occurred because there was lack of access as symptoms were gathering, right? So the patient starts getting sick, doesn't have the access required, ends up in the hospital, but they didn't have to be there if they would have been able to get access. Oftentimes it can be done through a bot, right? So 55% of
that's a huge number, Paul, right? That's a huge number.
I really like, and then in closing, in the end, how you talked about your role as an architect, because one of the things we're trying to do with the group is, you and I talked about this in San Francisco, is, it's really a community-driven effort to get more folks interested in health tech or grow their career. Maybe they're doing something now, and they're a radiology tech or this type of doctor, and now they want to break into computer science, right? And so I really like how you called out your role and what you're doing in that space. So I guess we'll close by. I'm just going to thank you again, Ronik. That's just amazing, and this is exactly the type of stuff that excites us here. In the community. So again, thank you so much for everything.
Thanks a lot, Paul. Thanks a lot, Paul, for having me here. I think it was my pleasure with this amazing community, and always up there for the community, and especially for healthcare. I love this. I love
amazing.
This.
Thank you, my friend.
And thanks to
I'm
all
sure
the
we'll chat soon.
Thanks, mate. Say.